The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome to Meet the Doctor. My guest today is Andrew Cohen. He's a facial plastic surgeon.
No, I'm a board-certified plastic surgeon.
An ordinary plastic surgeon.
You know, the facial guys like to call us a general plastic surgeon, and it's really not a good, there's nothing general about us. I'm a board-certified plastic and reconstructive surgeon, so I operate head to toe.
You can do it all.
Yep.
Do you specialize?
I do. I find myself specializing in mostly breast and body work. That's the majority of what I do. I do a lot of faces now as I've been getting older and more gray in my hair. I'm actually doing more faces and eyes, but I do a ton of breast reductions for teenagers, for older people. It's been really, my niche is really mommy makeovers and breast reductions is what I would tell you. I do about 70% body work and 30% face.
Excellent. And so today you're in Encino. Your practice is there now, but you used to be in Beverly Hills.
I used to be in Beverly Hills. It was 18 years of being in this city. I enjoyed it, and I enjoyed more leaving it. I like being in a little community called Encino. It's about 30 minutes outside of the city, and it's near my house. I like being very close to my house, Eva. I don't like to drive on the traffic. I don't like freeways. I don't like traffic. I mean, you should have seen the freeway today. I mean, everyone's on their phone.
I don't drive in California because it's too scary.
Yeah, they're on their phone. And, you know, my youngest son is about ready to get his permit. And I feel for him. It's very scary driving on freeways. So not to digress, but I moved my office 4 years ago to Encino. It is about 3 minutes from my house. It's just more convenient. I'm able to offer a bigger office and operating room. I built out my own Quad A certified operating room now here in Encino. So for me, it really boosted my practice and my ability to provide a better experience for our patients. I wanted to have my own operating room. I've always wanted that. I just didn't have the space to do that in Beverly Hills. And here I had the space to do it and a great staff to do it. So I'm very, very happy with that move I did 4 years ago.
Was there anything that surprised you about moving down the freeway that way?
What surprised me, you mean moving to Encino, I think how friendly everyone was in the medical building. I'm the only plastic surgeon in my building, which is very rare to say in Los Angeles. There's at least 10 plastic surgeons in every building on the other side of the hill. I'm the only plastic surgeon in this medical building. So that surprised me. That I was very happy when I found it, that I was the only one. But it surprised me how friendly the pediatrician, the heart doctor, the whole team, and all the other doctors, the pharmacists, we have a pharmacy downstairs, how friendly everyone is and outgoing and welcoming. So that surprised me because LA can be a tough place.
Moving after, you said 18 years?
Yeah.
That is an adjustment. And I wonder, how do people find you now that you're down there?
Oh, they always found me. I was always operating on this side of town. There was an operating room I was using on this side of town. So there's a lot of people that, you know, people from Lancaster, people from Thousand Oaks, Woodland Hills, all the outlying cities. They knew I would also operate in Encino as well. I had an OR in Encino I was using and Beverly Hills. So I've been on this side of town a little bit my whole career, but mostly Beverly Hills. But people find me word of mouth, but a lot of Google, a lot of Instagram. These days, TikTok and Instagram are pretty common. But people find me through word of mouth or other doctors. I really pride myself on trying to meet the internal medicine doctors, the pediatricians. I provide a service at the local urgent care here in Encino, or I should say it's Tarzana, called PM Pediatrics, and they just cater to children. And so I get called to sew up kids all the time, and that's a really good way that I've given back to the community and met the parents and the moms who want mommy makeovers through sewing up their kids. So, you know, people know me and I get around.
I think there's a nice element of staying grounded when you see people other than cosmetic patients all the time too.
For sure.
Yeah, pediatric plastic surgery. You have scared kids and scared moms and scared dads.
Right. And so we can make the experience a really good one for them. And that's kind of my goal. I've sewed up so many children in my career that now I'm so used to it that I challenge myself to see, can I sew up this child without them crying? So I actually have some tricks that I use,
Ooh.
and I'm very successful. And that's kind of like what I do, because I do it so much now. I say, okay, Andrew, you're going to sew up this kid, and he or she is not going to even peep, not going to cry. They're going to do great. And so I have some techniques I do that's been that I've used over the years, and it works. I can usually do it.
I'm going to need you to share those now, because I took my daughter to get a splinter taken out of her foot on Sunday morning, and she was like a raccoon in a bag.
Yeah.
So what is your secret? How do you get them to?
The ER will put tack on the laceration before I get there. They'll put numbing stuff on for about 20 minutes before I get there. Then I get there, it's already been numbed up. We put them in a papoose. So the little ones are put into a papoose, so they can't be a little raccoon in a bag, because we lie them down in a papoose, which just straps them down.
Uh-huh.
And then I squirt my local into the laceration. I squirt while I'm talking to the mom and dad and saying, this is numbing them up. So before I go in with anything, I'm locally injecting the laceration with local so they don't feel it. And then you put bicarb in the local because it makes it less acidic and won't sting. So bicarb, and then you inject it very slowly. Slow injection, bicarb, infiltrate the wound with the local. And then it's already pre-numbed for me because he put the numbing cream on before I got there. So those 4 things will usually do it. But sometimes they still cry because I don't want to be in a papoose.
Right.
But as long as my needle doesn't hurt, I do everything I can so that needle doesn't cause them to cry, then I'm good. And then the nurse is holding the head for me.
Sure. What about dad jokes? You got those?
I have a lot of dad jokes, but I have to listen to them on Spotify. I have a dad joke. Here, I'll pull it up for you. This is the dad joke podcast. Did you know there was a dad joke podcast?
No.
No. Yeah, there is. There's a dad joke podcast. I won't play it, but it's on Spotify. Anyway, I was going to pull it up to show you, but
yeah, we'll link that
Spotify,
in the show notes so everybody can find it.
Oh yeah, it's called Daily Dad Jokes, and so absolutely, I don't use that at work. I actually use that in the operating room more than going to the urgent care sewing up a kid. It's mostly in the operating room.
So your team gets the benefit of your dad jokes?
Oh yeah, they do. If it's on a good day, they do. Yeah.
Do you remember any of them?
I don't. And now you put me on the spot. That's the hardest thing.
I know.
To remember a joke. Oh my God. I'll think of it as we hang up, or I'll try to think as we go.
Okay. Yeah, all we have over here is why did the chicken cross the road jokes with nonsensical answers.
Oh no. I see. I used to have them all. Now I can't think of one.
Okay.
Stage fright.
They'll come back to you. They're always right there. Plastic surgery in California is a little bit of its own animal. I think it's easy to get caught up in, fads and trends, especially from the media, also new technology. Is there anything that you can think of that would help us focus on what's important if we're thinking about doing a mommy makeover or a tummy tuck or any kind of body surgery like that?
Before I answer that, can I ask you another question?
Sure.
Do trees poop?
I'm afraid to say yes.
Of course they do. Why else do they call it a number 2 pencil?
Oh, no.
I remembered it.
That's really bad.
It took me a second. Come on, that's a good dad joke.
I know. I'm going to immediately tell it when we're done to the child in the other
Jamie,
room.
my office manager's kids love that one. They're little, and they love that joke. That's like their favorite one. The number 2 pencil. Okay, so going back to your question, sorry.
Yeah. How do we, if we're considering a mommy makeover or tummy tuck or something like that, keep focused on what's important and not get distracted by trends or media or Instagram or unrealistic ideas on Instagram?
Are you saying how do we as patients, or how do we?
Yeah, as patients.
Oh, that's hard, because the patients are always looking at these snatch pictures and thinking that we can actually do that. And sometimes you can't. You can't always make a 6-pack with a tummy tuck. You can't always do it without incisions. And so when they come and visit me, I kind of give them the scoop that, hey, man, this is real surgery. You're going to have an incision hip to hip. Why can't I have a mini tummy tuck, doc, instead of a full? Well, do you want to be mini happy or full happy? That's not to say I haven't done many tummy tucks, because I have actually quite recently and been very successful. But for the most part, if you want all the skin removed, you want to be full happy, not mini happy. So we're going to do a full tummy tuck. How do you not get distracted was your question, or focus on the most important things? That's really hard to answer for you, because everyone is distracted by that iPhone as well as myself. So it's hard to put it down and not be looking at all the pictures and the doctors and all that. And I guess what I would tell you is that's another reason why I focus on tricks and pearls to heal preoperatively and postoperatively. And I try to give people hints on my Instagram and TikTok pages to help you heal better. And I think that that resonates with patients, that we're not just trying to show off pictures of big breasts or tight butts or big butts. I'm trying to focus on how are you going to heal better, faster, and have a safe surgery. And that's really our goal. Our goal is safe surgeries and getting your core reconstructed if it's a mommy makeover, a tummy tuck, but also living a healthier life. And I think that patients, it really resonates with patients. And I think that that's important, that you want to go to a surgeon who's really not just out to show off your picture on Instagram or TikTok, but interested in getting your health back and doing a healthy, safe surgery.
You were practicing before Instagram. So do you find that the pictures that people bring in help your conversations, or do they get in the way?
I love pictures. Bring pictures. It does not get in the way. I enjoy getting in a patient's head, because if you do as many breast reduction as I do, you've got to get them to the right size. Whether it's an augmentation or reduction, both are quite difficult in terms of getting into that woman or girl's head. What size would you like to be? And sometimes they'll bring pictures where they're covered with a bathing suit or covered with clothes, and they want to look like this. And I'm like, well, she's wearing clothes. I don't know what that is. Why are you showing me? And by the way, you've had 4 children. Why are you showing me a woman who's 20 who's never had children before? Do you really think that I can make you look like that? You have stretch marks, or you've lost 50 pounds. You have stretch marks. Your nipples are down here. You're showing me a 19-year-old with saline implants who's never had children before. You're not going to look like that. So actually, pictures are good, because if they think they can look like that, me as a surgeon have to bring them back to reality and say, listen, I can't make you look like that. But here's what I can make you look like. Look at these pictures on my iPad, or look here at my gallery. And I think reality is really important. So while the Instagram and TikToks are fun, I think my job is also to bring people back to reality.
Where's a good place to look for photos that would look like ourselves, without...
I think the galleries, I mean, if you look at a doctor's gallery, that's where he or she is putting their best work out, in my opinion. Now, it depends if that doctor is really spending time to put their nice pictures on there like I do. I really spend a ton of time sending my pictures to my website people to put really nice pictures on there, and they're close up and they're big and you can see. And I try to put the age, the height, the weight, and what implant I did or how much grams I removed. I don't always do it, but I've been trying to be better about that. But the pictures are very clear and concise. And I think that as a patient, I would want to see a gallery of befores and afters. And if the afters have clothes on, like a bikini and really? This is not, the gallery should be a plastic surgical picture, how we take photos before and after, and be consistent and concise. And if they're covered with clothes, that's ridiculous in terms of when you're seeing the breast or a tummy tuck.
I don't have a great analogy for this. I sort of feel like it's the broken windows theory of plastic surgery photos, that someone's gallery, we as consumers have very little to actually judge your skill by. And
Correct.
not just the photos themselves, but the quality and the organization of the photos tells you so much about a practice.
Correct.
And years ago, I remember my hairdresser, who I saw for like a decade, coming to me. People ask me questions all the time because I've just been around. And she wanted to go to Costa Rica for a facelift. And I said, how many photos do they have? And she looked and she said, 7. Okay. Call them and ask them, do you have more? And see what they say. And they were defensive. And I was like, this is all the information you need.
Right.
If they don't have more, I mean, it's possible that they just didn't get around to putting them on the website.
It is possible.
Because people are busy.
Yeah.
But if they don't have any proof, then you should probably take that as a signal.
I agree.
And your galleries are exceptional. And they're easy to look at, easy to navigate. So, yeah, we just all want to find someone who looks kind of like us.
Yeah.
To see where we might be able to go.
Correct.
Is there any technology that you're excited about in the future or anything that's new and coming on the horizon?
What's crazy is there's always new technology. And I'm very fortunate that I have a room here now to have a nurse to help me with all the lasers and other devices. So my latest device is, and by the way, sometimes I'll be honest with you, I don't get the latest and greatest. I kind of wait to see if they work. So I am not someone that has M-Sculpt. I'm not someone that has Cool Sculpt. I'm not someone and they all come and let me use it and all this. I don't even have J-Plasma. We can sit and talk about technologies. Let's talk about what I do have. I have microneedling, a skin pen. Did I just get it? Yes, I just got it. Sounds crazy, but it works. It works for scars. It's microneedling. It's a little handheld device. Alana, my nurse, does it. It works. It helps blend your scar and puts holes in the scar. And is it new? No, it's been out for a while, but it works. Some of the new, I want to use technology that works. I don't want the latest and greatest. These are very expensive machines, so I need to know they work. So microneedling and Laser+Genesis. Well, let me go in order. The Genius device is a radiofrequency microneedling. It's called the Genius from Lutronic. That is the latest device I have. You don't call it a laser, it's a device because it's radiofrequency microneedling. Helps tighten the skin, gives you a little lift. You got to do 3 treatments. Alana does it for us. So I do like that machine. We did get it a little while ago, and I really like it. Patients have loved it. So that's the Genius. And I told you about microneedling just a scar because I make so many scars. I needed something better to get the scar blended after a breast reduction or a tummy tuck. We want to be able to offer people a little more oomph to their result rather than, give it a year, it'll heal. The third one I should mention is the Cutera Laser+Genesis. And that one Alana's been using a lot. It puts a little heat into the skin. It helps acne scarring, decreases the pores, and increases the collagen and things as well. But it's heat, so Laser+Genesis. And with that Cutera laser device, there's another handpiece that's an IPL. So I have an IPL handpiece, a Laser+Genesis to help the acne pores and help the skin overall that people come in once a month for. The Genius is a skin tightening, radiofrequency microneedling, and then just for scars, the skin pen. So we got 4 different things now, which sounds crazy, but Alana's in that room busy all the time taking care of patients. There are newer technologies. Ultrasound right now is trying to make a comeback. I mean, if you want to know about this, I don't have them, but I'm happy to talk about it if you wish. Ultrasound's trying to make a comeback. There's a company that has a newer ultrasound to try to tighten the skin. It puts parallel beams under the skin. They just came and talked to us last week at the LA Society of Plastic Surgeons meeting I was at. I have a friend in Manhattan that's using another one that puts, I don't know if I'm allowed to say the name of these lasers, but it's not a laser, it's a device that puts bigger holes into the skin and lets you heal and tightens up the skin.
The Elicor?
The Elicor, right. So
Yep.
Elicor is out, that's new. I love hearing about that technology, to be honest with you, but I can't buy every single machine. I'm just going to buy what works for us right now.
What do you like to do to unwind when you're not at work?
I work out a lot. I've been trying to increase my workouts to once a day rather than 3 to 4 times a week. I'm trying to do it, every day. I like to run. So, I'm trying to motivate myself to do another half marathon this year. That's why I sighed, because I'm still trying to motivate myself. I went 8 miles this weekend, but half marathon, usually do a half marathon at least once a year. And there's one coming up in July. I'm trying to get my brain on it to see if I'm going to do it or not. So I like to run. I like to exercise. I work out with a trainer, weights twice a week. I like the Peloton. I like the Peloton bike and tread. I'm kind of spoiled. I have both. I know it sounds crazy, but I do.
I didn't even know they made a tread.
They do. It's really fun. I make myself go on that sometimes. It's fun. What else do I like? I like to read. If I can put my damn iPhone down, I like to read. I like to go to the beach. And in the summer, I like to paddleboard. I think paddleboarding is awesome. I've tried surfing. I'm really not that great. I can't even stand. It's so hard to stand on that surfboard. But I had a coach that was trying to take me out, but I'm not, I can't call myself a surfer. I call myself an aspiring surfer. So on the summer, I'll go over to Malibu and I have a guy that'll bring a paddleboard out and we go out for about an hour. So paddleboarding is so much fun and hard, you know, in the ocean. It's really tough.
I think it's just so bold that you put yourself surfing on your website, on your about page.
Well, it's aspiring. I can't really claim it because it is. I've tried. It's hard to stand on that thing. It's
But
so
do
hard
people
to
comment
stand.
about those photos a lot when they meet
Yeah.
you?
Yeah. They do. And it's cool. But I just tried it when I was 50. I was like a few years ago. Like I got to take a lesson. And it was fun. I did one lesson in Hawaii with my son Gabriel. I have three sons. And Gabe and I did it in Hawaii a couple years ago, and it was his first lesson. And on his first lesson, like he and I were actually standing at the same time. So not many people can say they've rode a wave with their son. I mean, that's pretty cool. And that was a good day. And he's now at UC Santa Barbara, so he surfs a lot. So it was a good day.
Are they the banana slugs?
No, I think that's Santa Cruz.
Oh yeah, you're right.
I think they're the gauchos.
There's two other interesting things on your website that I want to call out. One is that you trained in Atlanta, and that particular training is really well known as one of the better places to train, isn't it?
It is. I mean, Emory is a foremost place in plastic surgery lore, and a lot of things came out of Emory. I can't claim to have been at Emory. However, I was at Pace's Plastic Surgery, which is now affiliated with Emory. At the time, you know, I was fortunate to go to their meetings and gave them a talk, just like one talk. I talked to the residents, but it was more of a private practice in Buckhead for well-known plastic surgeons. I should say 3 well-known plastic surgeons and 1 oculoplastic surgeon was in charge of our fellowship, which isn't there anymore, but at the time it was highly esteemed fellowship and one that everyone was wanting to go to. Pace's Plastic Surgery with Rod Hester and Fawad Nahai. Sonny McCord was the oculoplastic surgeon, and Mark Hodner was the other plastic surgeon.
I mean, that's sort of like a Hall of Fame, right?
It was awesome. I mean, it was 6 months. It was hardcore. A lot of facelifts every day. I mean, every Wednesday where we were fixing eye shapes, cheek lifts, fixing eye shapes with Sonny McCord, and he'd give me a lecture once a week. And a lot of facelifts. I would follow the facelift patients. I mean, there's at least 2 or 3 faces going on every day. It was fabulous. Great experience. They put me up at a condo like across the street so I can, you know, finish the day around 5 or 5:30. Go walk over, have dinner with my wife, and I had a 6-month-old child at the time. And then I would come walk over back and check on all the facelift patients in the recovery center in their office. They would recover right there.
Oh, wow.
So it was a blast.
And that was your evening job, was to go back and make sure they were okay?
Yep. By 7:30 or 8, I had to go back and check all the facelift patients, check the drains, make sure there's not a hematoma.
Were they staying overnight?
Yeah, they stayed overnight with nurses. They had surgical suites, like a hotel suite in their office, and they had a nurse watching them.
Don't see that every day.
I know. I wish we could do it here in LA, but you can't. I wish.
The other thing that I see here is that you've been to Argentina for missionary work.
Yeah, I mean, I did missionary work as a resident at Loma Linda. I went to Loma Linda for my 3 years of general, 3 years of plastic surgery from 94 to 2000. And part of the residency training, and I think it is even to this day, is to do a mission trip. So I went with my colleagues and one of our attendings to Argentina. We did a mission trip at St. Martin in Argentina, University de La Plata. We did a bunch of surgeries. And I wish I can tell you I've kept up on doing mission trips, but unfortunately, Eva, I haven't. And that is one place in my career I need to pick up on. I have a really good friend in Redlands that does a lot of missionary work in India, and I think he's going to Croatia. That might be a trip. That may not be a mission trip, but he's going to India to do a mission trip and other places. So I'm probably going to start going with him. It's just that with the kids, I wanted to be around. I don't want to be away when kids are small.
Will you ever do another one, maybe?
For sure. Yeah, I want to go with my friend, Dr. Punjabi, who's in Redlands, and I'm going to go with a friend and do that for sure. I think it's an important part of plastic surgery. You got to give back. That's an important part of what we all do. And that's what, at Loma Linda, that's what they instilled at us. So I definitely have to start doing some mission trips. So we'll do it again.
Sounds great. If someone's listening today and they want to learn more about you, where would you send them to do that?
I would probably send them to the website. It's just Andrew Cohen MD, or Instagram is Andrew Cohen MD. Either Instagram or the website. And TikTok is the same thing. It's Andrew Cohen MD. We made it easy.
And if they come into the office, they should bring you their best dad joke.
They should, for sure. I like my number 2 pencil.
All right, we're going to try to unseat the number 2 pencil as the number 1 joke.
There you go.
Thank you so much for telling us about yourself today.
Thank you so much, Eva. Appreciate it. Thanks for your time, and we look forward to doing this again sometime.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor, or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.